Hey guys, so in this video I'm going to talk about the spine. So first let's see the anatomy of a vertebral body. But before that, let's see the Danish 3 columns of spine. So uh, Danish has divided spine into the 3 columns: anterior column, middle column and the posterior column. So in anterior column, there is anterior and middle column will form the vertebral body, and posterior column will be formed by all the posterior part like pedicle, lamina and transverse and spinous process, anterior and inferior process, and all the including all the articular facets. So this is the whole classification, that anterior, middle and posterior. Anterior and middle combiningly formed by the vertebral body, and the posterior column is formed by the posterior elements. And in that we have to also learn about the all the ligaments associated with spinal column. The body of vertebra. So spine is a series of vertebra, and we have actually divided spine into 5 parts. Vertically it is divided into 5 parts: cervical, thoracic, lumbar, sacrum and coccyx. Now we are going to learn about the each vertebra. So first and second vertebra are slightly different from the rest of them, so we are learning the typical vertebra. So first is the body, then there will be pedicle, then lamina of the vertebral arch, then will be 2 processes: spinous process and the transverse process, and there will be superior articular process and inferior articular process. And when will be the facet? So superior articular process has superior articular facet to combine with another vertebra that is above this vertebra, and it will combine with the inferior articular process of the upper vertebra. Same way, in the inferior articular process there is inferior articular facet. Now there are 2 facets actually to combine with the rib. Let's see. So superior costal facet and inferior costal facet, this is at the junction of the body and pedicle, and we have talked about superior articular process, inferior articular process, this is at the lamina, right? Now, and also transverse costal process is at the transverse process, and it will also articulate with the rib. As we can see that transverse process will articulate with the articular facet of tubercle, and superior and inferior will bind with the inferior articular facet and superior articular facet respectively. So this is about the anatomy of the vertebra and how it is articulating with the rib and the upper and lower other vertebrae, and will try to help in the formation of rib cage and the vertebral column. So we have seen the parts that it is a body, then pedicle, lamina, spinous process, transverse process, then facet, superior inferior costal facet, superior and inferior articular processes, and transverse facet. Now between 2 vertebra there is intervertebral disc, and which is formed by nucleus pulposus in the middle, surrounded by the annulus fibrous, as we can see in the picture. And as we have learned that true vertebra has a facet joint, and it has joint capsule and joint cavity, and this is also known as pars interarticularis. So pars interarticularis. Now there are ligaments, so we have to learn about the ligaments. So the body has two ligaments, anterior longitudinal ligament and the posterior longitudinal ligament, and the posterior ligament complex that will come into the posterior column has ligamentum flavum, interspinous ligament, supraspinous ligament, as we can see here, and facet capsule, and there is also one ligament, intertransverse ligament. I don't know how they are classified. So anterior longitudinal ligament, posterior longitudinal ligament, ligamentum flavum, supraspinous, interspinous, and intertransverse ligament. They will be from axis to sacrum, axis to sacrum, axis to sacrum, and supraspinous will be only there to thoracic and lumbar, interspinous in lumbar, intervertebrae in the intertransverse in the lumbar. So this is about it. Now one-liners point about the spinal trauma. So most common mode of spinal trauma, there are mainly two methods how spinal trauma can happen: road traffic accident and fall from the height. So in developing countries, fall from height is most common, but overall most common in developed nations are the road traffic accident. Now most common mechanism of spinal trauma is flexion distraction. As we can see, we will see in the seat belt injury that the fracture is happening. It is known as the chance or jackknife fracture, and this will lead to this is due to flexion distraction type of injury. So that's why maybe it is the most common mechanism of spinal trauma, and the worst one is translation. Okay, now there is some fact about the anatomy. Most constant number of vertebrae is in the cervical region, that is 7, and most variable number of vertebrae is in the coccygeal, and spinal canal is widest at the level of C2, that is axis. Now most common level of spinal trauma is C6 cervical spine, and spinal fracture will occur at the lower thoracic spine, and obviously spinal trauma is most common at cervical, so spinal cord injury will also be happen at the cervical spine only most commonly. Just the fracture one is different, it is at the lower thoracic spine level. Now apart from spine, if we see in skull, temporal bone is the most common bone to be fractured, then facial nasal bone is most common one, then zygomatic, and in mandible, neck of condyle is the most common one to be fractured. Now the spinal fracture. So there are mainly 6 fractures that I will be talking about. Then the spinal cord injury, and then we will learn about some congenital conditions like Klippel-Feil syndrome, then the scoliosis, and congenital muscular torticollis. Okay, then TB, spine, and some inflammatory condition like ankylosing spondylitis is also in my list, so I will include them after this video. Now, so spinal fractures. So Jefferson fracture is a burst type of fracture of ring of atlas, mean first cervical vertebra, and how it will happen. So it is due to fall from the height. So what will happen that when the person is falling from a very much higher height, what will happen that the translation force will come from down to upwards, and the first vertebra will fracture due to this force, and it will be type of burst fracture. I have learned that burst fracture is a type of compression fracture. I mean, I have to see that what is a compression fracture actually. I just don't know. Compression fracture. A compression fracture is a type of fracture or break in your vertebra The bones that make up your spine. Osteoporosis is the most common cause of compression fracture. Other causes include injuries to the spine and tumor. And the three type of spinal compression fracture are wedge fracture, crush fracture, and the burst fracture. Wedge in the front of the bone will collapse, but the back is unchanged. The entire vertebral fractured, not just the front of the vertebra. This most severe fracture that usually happen after a trauma. Okay. Spinal compression fracture. Vertebral compression fracture, they often result from osteoporosis but can happen after trauma. So compression fracture, let's see this one. Vertebral compression fracture of the spinal column can occur secondary to axial compression load with resultant biochemical failure of bone resulting in fracture. Definition: compromise the anterior column of the spine, thereby resulting in compromise to the anterior half of vertebral body and the anterior longitudinal ligament. Load axial with resultant biochemical, by definition compromise the anterior, that's same. Do not involve the posterior osseous compartment of the posterior ligament complex. The former distinguish a compression fracture from burst fracture. This implies of this compression fracture are related to the stability of the resulting structure and potential for deformity. Progression compression is usually considered stable and do not require surgical instrumentation. Okay, the former distinguish a compression fracture from burst fracture. The complication of this compression fracture are related to the stability of the resulting structure and potential for deformity progression. I don't want to go in this detail, it is too much for me now. So Jefferson is a burst fracture of the ring of Atlas. Both arches are involved due to fall from the height. So at this level I am going to remember that Jefferson is due to fall from the height mainly. That mechanism I have to remember. And which vertebra is involving? It is involving the C1 vertebra, and so C1 vertebra will be involved and both arches will be involved. It is a stable fracture. 80 to 85% of patients don't develop any neurological deficit. Now burst fracture, type of compression fracture only retropulsion of posterior cortical fragment into the spinal canal. Okay, now the hangman fracture. So hyperextension followed by distraction. In hangman fracture what will happen? Hyperextension will happen, while the chance fracture or seat belt injury, jackknife injury, there will be flexion distraction. Okay, there will be flexion distraction. Here will be hyperextension followed by distractions. Now what will happen in hangman? There is spondylolysis of C1. So intervertebral C2, intervertebral disc with disruption will happen at the C2 C3 level. And in chance fracture, jackknife fracture, horizontal fracture line translate cutting across all the columns of the spine, including spine. That's why they are called as jackknife, because horizontally it is cutting all of the things that is coming in the way. And chance fracture, seat belt, jackknife and chance, we have to remember together. Hangman is easy one to remember, and Jefferson is also, I think, easy. There will be no problem. Now Clay-Shawler's fracture, that is tip of spinous process will be fractured, and C7 vertebra will be involved due to violent lateral rotation of the neck. Now Undertaker's fracture is a post-mortem finding, and what will happen that the careless handling of the dead body by undertakers will result in the C6 C7 intervertebral disc disruption. There is also one fracture called as carrot stick fracture, that is happen in the rigid fused spine seen in ankylosing spondylitis. Now spinal cord injury, young patient accident will be there. In road traffic accident, there will be no reflex, a patient will be unconscious, low BP, low PR means patient is in the spinal shock, means spinal cord injury will be suspected. If this finding we will see. Now there is one important reflex, bulbocavernous reflex. The importance is that it is the last reflex to disappear and first reflex to reappear in the spinal shock, and in female it is called as anal wink. And what will happen that from the penis the sensory fiber by pudendal nerve will go to C2 C4 sensory roots, and from there only motor roots will come out, and motor will be by pudendal nerve and perianal muscle will contract. So this is about it. I will cover the congenital one in another